Thank you all for joining me this evening. So tonight we're going to talk about transforming your skin with active and deep effects skin resurfacing. So like I said, I'm Dr. Emily Wood. I'm a board certified dermatologist here in Marble Falls. And then I'm also a fellowship trained cosmetic dermatologic surgeon. So basically what that means is that I did extra training after my residency in lasers and dermatologic surgery. And one of those areas of training was in CO2 laser. And so, specifically, the one that we offer here is the active and deep FX. And so, we'll get into more of that. So, prior, I was doing a lot of these treatments over in Bee Cave, and then my schedule has changed a bit. So I'm strictly seeing patients now in Marble Falls. And so I wanted to bring this laser here. So we did that. So I thought this would be a good way to introduce the new technology to Marble Falls and to just give a good overview of what it can provide for your skin. So active and deep effects. So it is basically a brand of CO2 laser, and CO2 laser is just a general sort of category or type of laser. So it has the ability to customize settings to your concerns, your goals, and also the downtime that you're willing to experience. So, what are the benefits of CO2 laser? So, it is the most advanced resurfacing treatment that exists. It helps to remove sun damaged skin. And I would say it's the best laser at stimulating collagen. So there's really nothing out there that can stimulate the amount of collagen that CO2 has the ability to. So what does it help with? So generally we're targeting wrinkles, fine lines, sun damage, uneven texture of the skin, pore size, as well as acne scars. It's also really good for that crepey, kind of thin skin around the eyes. Of course, we use special precautions with the eyes, which we can get into later. It's great as well for the, I would say, vertical lip lines or smoker's lines that I see that type of concern over and over again. And, it can try to be addressed with filler and Botox, but I think at the end of the day, CO2 laser is really the most long lasting, effective, natural looking treatment that can be done for that. And so, how does it improve the skin? So, CO2 laser is generating new collagen and it produces smoother, firmer skin. And it actually generates collagen up to 1 year post procedure. So there's literally nothing out there that will provide that for you. And then results beyond just visibly what you see is that it can treat precancerous sun damage. It improves your overall skin health because you're generating all these new collagen layers. It has also been shown to decrease the development of skin cancer, so such as basal cell carcinoma, which that is of importance. So results will look like a brighter skin tone, smoother texture, and long-lasting results. Like I said, it can be very customized to what your goals are and what your downtime kind of is. But typically, when we're doing a CO2 treatment, we are having the goal of doing something that's long lasting. So most patients only do this every, I would say, 5 years or so. It's not always something that you do kind of on a yearly basis. A common question that I get is, what is the downtime and the healing? Again, it depends on your specific concerns, what we're trying to address. If you have deeper fine lines that we're trying to erase, years of sun damage, then you're going to have a longer recovery period. But you can expect redness, peeling, swelling. The swelling really lasts for about 24 to 48 hours. Now the redness, the peeling typically lasts 10 to 14 days. And I would say the redness can last for actually a few months. And that's because you have all these nice new collagen factories that are generating this new baby skin. So it does tend to leave people a little pink, but at about a month, you can typically like cover a lot of that with makeup so that it's very, minimally visible to, other people. And so another thing that you might read about online if you're looking into CO2 laser is fractional versus fully ablative. And the Active and DeepFX machine actually has the capabilities to do either a fractional or a fully ablative procedure. So the fractional just means that there's tiny little beams going into the skin surrounded by healthy normal skin, which shortens your downtime. So if you're someone who has maybe milder sun damage, then that might be a great option for you if you're wanting to do kind of a rejuvenating laser treatment with not too much downtime. That could be a great option if you're someone who's, we're working with, years of sun damage, some deeper kind of fine lines, then we might need to do something that's more fully ablative. So you will have a little bit longer downtime, but in the end, I would say the results are worth it. And we'll kind of go through what you can expect, results wise. So this is a nice progression that I took of a patient I treated several years ago, just of her healing time. So this picture up at the top here, that's about 48 hours post-treatment. So you can see it's kind of oozy, crusty red, but she's actually not in pain. So it's really just that first 24 hours feels kind of like a sunburn. And then you look a little bit oozy, but you're not in pain. Here's about 10 days. So you can see a lot of the crust has peeled off. She is pretty red. And then this is about 3 weeks out. So pink, but not terrible. So it gives you an idea of what to expect. And then I would say this is about a month. So we did treat this patient around her eyes and her mouth. And those areas typically stay the most red. But at that point, you can cover a lot of that with some, medical grade mineral makeup. And then again, that's about 6 weeks. So still kind of pink. This here is about 3 months. Still some pink undertones, which will resolve with time, but it's because you just stimulated all this new collagen. So it does tend to give you that rosy undertone. But I like showing this picture just because it gives you like a good idea of kind of what to expect. So this is a patient here, her before here, and then her after. So she had some really deep, which we have a nice close-up picture, but deep vertical lip lines, which she had tried some other lighter lasers, filler, just nothing was really addressing her true concern. So she came to me interested in CO2 laser. And you can see just overall her complexion is much more glowy, it's smoother. And then we'll show you kind of the close up here of around her mouth. But you can see, I mean, from here to here, that's one treatment of CO2 laser. That's her 6 month after photo. So, I mean, significant difference. I don't think there's anything else out there that will give you these types of results. And she was very, very happy because she had tried so many different things. And we finally found something that really just took off years as far as her appearance. I feel like the vertical lip lines are often what sort of age people. And so she was very happy with her results. Another benefit here is we treated around her eyelids. You can see before she had some hooding. This was totally just with a laser, so no incisions. She got a little lift here. You can see more of her eyelid there. So I think that's another consideration is I'll even have patients a lot of times just come in and treat around the eyes because it does a beautiful job of tightening up that eyelid skin. And it really also will thicken up this under eye skin here so that you don't feel like you have to wear as much concealer, which is a great benefit. And then this is a little bit younger patient, but I think she's a good one to show. Just kind of like she had some mild sun damage, wanted to get ahead of the game, and do something great for her skin. But with these side profiles, and she doesn't have on makeup in her after pictures, but you can see just that dramatic reduction in sun damage. Her skin's just tighter and brighter. And so, yeah, the only makeup here she has on is just mascara, but that's it. And then again, here, I think that's a great picture. I mean, she had tons of sun damage, just nice and cleaned up. Um, so that was a great result too. And then here's another one where we had another patient I treated. Again, the vertical lip lines were just really bothering her. Had tried some various things to address those, nothing worked. So for her, we only treated around her mouth area. Um, and she did kind of a wider laser. She did a Fraxel actually for the rest of the face. So it would be technically that was a non-ablative, but we did the CO2 here around the mouth. And you can see, I mean, that took years off her appearance. I would say it made her look at least 5 years younger. So she was super thrilled with her results. And again, it's long lasting. So it's not something you have to go through, multiple times. It's a one and done type of treatment. So again, we were kind of talking about the difference between fractional and fully ablative, and I don't want you to even get too caught up in this because you can tell me during your, individual consult what you're looking for, and I will know exactly what you need with this laser. But the point is that it's customizable. So it can be, really aggressive, or it can be a little bit lighter, but just give you some nice rejuvenation, but still, you're able to get back to your, social calendar with not too much downtime. And I would say, it's really the best for sun damage, if you have any acne scarring, crepey skin. Those are kind of the things we're treating with this. And again, it's also helping prevent precancerous and cancerous cells to grow. So a good laser to do to just kind of clean up all that sun damage. I do recommend though, with CO2 laser, active and deep FX, personalized consults and making your personal treatment plan is best. So we'll talk about this a little bit more at the end, but I really want to meet with each of you, if you decide this might be right for you, and come up with your customized treatment plan. So we'll do some questions. So if this generated any questions for you, type them in the Q&A box and we can just kind of go through those together. But a few other things before we get to those. Just as a thank you for attending, you will enjoy 15% off a treatment with me if you book your treatment by the end of March. So those treatments will be done here in Marble Falls. So even if you live in Austin, it's really not that far of a drive. So it's a great time, to take advantage of this. And it's still a little bit before summer, so you have time to heal up before it gets more sunny and bright outside. And then here is the booking information. So if you're like, I do want to meet with Dr. Wood, you can call this number, or you can book a consult with me online by clicking this link. And this is also just my team has an email, and so we just are happy to answer questions there. And then additionally, once we're done with the presentation, you're going to get a follow-up email with contact info for the lovely Devin. Devin is one of our consultants here, and she is able to answer a lot of questions too. And if you do live closer to Austin or Bee Cave area, you can make a consult with her and she will connect you with me. So we really want it to be easy for you. But consults with me are totally complimentary. So just because you book a consult, it doesn't mean you're like locked into it. But that will allow us to, go ahead and make a plan for you. And then if you are like, you're like certain you want to do this, then you can call our office and actually book your pre-op appointment. So we do schedule a pre-op appointment for all of the CO2 laser treatments because there is some aftercare that's involved. So we want to make sure you're like totally ready. You have all your aftercare supplies, which most of those can be purchased at our office. There's like a couple of things we have you get, on Amazon or at the drugstore, but we just want to make sure you're like totally ready and we go over, a few things before we have your treatment day. So let's see, try to get to some of the questions. Let me get out of this presentation. Let's see, it looks like we have a couple. I'll just like read them out for everybody. That way we can all, benefit from the questions. So the first one is, what is the difference between deep FX and old therapy? Which one is better? So deep FX and old therapy are a little bit different. So deep FX and active FX basically is targeting the more like fine lines and wrinkles, whereas old therapy is targeting the deeper collagen layer, so more lifting. So I would think of, active and deep FX is addressing texture, fine lines, wrinkles. Old therapy is going to be more for lifting, tightening jawline area. If you're interested in old therapy, I do that too. So we can always talk about that as well on a one-on-one basis, but that's a great question. Another question is, does it work for broken blood vessels? I have some around my nose. So a lot of times my patients will have that same concern. And so typically what I'll recommend is that we also treat with a laser called V-beam on the same day as your CO2 treatment. So you would do your V-beam first, and then we would have you do some topical numbing, and then we would do the CO2 just all in one day so that we just address all of your concerns. Another question, can you speak on how it does for acne scarring on the skin? So I will say acne scarring is very specific to each individualized patient. So I will say many times acne scars do need to be treated with laser plus filler sometimes, which we can go into that, in your consult. But acne scarring, typically has surface irregularities as well as, some areas of volume loss, but it does do a great job with acne scars. And I would say it's a great option if you do have that. Sometimes with acne scars, we do, need to do more than one treatment. But again, that's kind of a very personalized question that I think, can be addressed in the consult. Please confirm someone at Westlake can do the consult for you. Great question. I hope, this wasn't confusing. So if you're closer to Marble Falls, I would say do your consult with me, or if you're closer to BK, just set it up with Devin, or if you have a hard time getting in with me, just schedule with Devin. She has great availability. She's very knowledgeable. I used to work side by side with her at Westlake, so she knows a lot of just my preferences, and she's amazing. She's been with Westlake for many years, so she's a great person to just kind of jumpstart the process for you. Another question, is this good for crepey skin on the neck and the marionette lines? So the active and deep FX, it can be used on the neck to help with crepey skin. I would say for marionette lines, that tends to be more of a filler concern. So let's see. These are all great questions, by the way, so thank you. Another good question, it helps decrease precancers and cancerous cells. Can it be billed to insurance? My answer to that is I would love that. However, insurance, It doesn't cover it, and I wish they did, but unfortunately not. Um, let's see, will it help with, okay, here's another question. Will it help with brown spots? So it does fade brown spots. I will say if someone has a lot of brown spots, what I'll typically recommend for best results is that we pair it with a laser on the same day that targets, some individual brown spots, kind of like I was mentioning for if you have redness. And then we also um, do your CO2 laser on the same day. So it's just kind of like you're already here. Let's just get everything we need to get. And sometimes it does mean that we pull in a little bit of an extra laser. Um, but that often means you get best results. And it's been proven to be very safe to use multiple lasers at once. And I have been doing that for many years myself. Here's another question. Is CO2 good for thickening skin on the chin from rosacea? Yes, it can be very helpful for that, as well as thickening on the nose that you sometimes get from rosacea. So let's see. Describe pain level experienced during and immediately after treatment. So typically, like if a patient is doing a full face treatment, we do give you a little IV cocktail to keep you comfortable, and then we do some nerve blocks in the face. I would say after it feels kind of just like a bad sunburn, and that lasts for about 24 to 48 hours. And then after that, it's actually not painful. So it looks bad, but it doesn't hurt. Let's see. Here's a question. If you have had Botox and filler, do you have to wait before you can have laser treatments? And my answer to that is really no. Sometimes we even will do, special cases where we do not necessarily Botox, but sometimes filler on the same day. So you're treating different layers, so it doesn't really affect that. Will it help scars from Mohs surgery? So a type of skin cancer surgery, if you're not familiar. Um, but yes, it definitely can. And I've used it a lot for that. Another question, how long does a session take? If we're treating a full face, I would say, your numbing process, you'll be here for an hour with topical numbing, and then we do some injections that take like 20, 30 minutes. And then the procedure itself takes about 45 minutes or so. So, yeah, if that gives you an idea. Good question. So I did mention a little bit that patient that I treated around her mouth lines. And then she didn't want to do a full face CO2 just here, but we did like a Fraxel here. So the Fraxel, it gets confusing, but the Fraxel I was mentioning, we did a little lighter on the rest of the face, was the Fraxel Dual. So it's a non-ablative laser. Um, so it is not a CO2 laser. So it can be very customized to what you need, which is what I love about lasers in general, is that it's like we have this beautiful toolbox of tools, and then we have our patient, and we can make it exactly what you need. And it doesn't have to be this cookie cutter setup where one size fits all. Um, Another question, is it okay to do laser after you've had Sculptra? Totally fine. Different layers of tissue that you're treating. Um, Another good question, what is CO2 best to treat for? What type of skin? So we mainly use CO2 for the face and neck. I will say CO2 laser, we do use it sometimes for scars on the body, but as far as like chest or even like hands, arms, it doesn't do the best on those areas because we have less oil glands, say on the chest. So CO2 actually needs those oil glands to be able to regenerate in the healing process. A good question. Do you need someone to take you home after the procedure? So if we are giving you the IV medications and say we're doing your full face and your eyes, then yes, you do need a driver. Now, if you were just doing, say, the mouth area, I actually did a patient earlier today just around her mouth. We just did local anesthesia, and so she was able to drive home. Yeah. Another great question that comes up a lot. So, are you sensitive to the sun during the healing process? Are you advised to stay out of the sun? So, we don't like you to get direct sun. I recommend that wear a big hat if you are going to go outside and like walk your dog. You can go outside, but you will not typically be able to wear sunscreen for a month after like a full face treatment. And it's just because your skin is so sensitive and delicate in that 1 month post procedure that you kind of just need to wear like a big hat, but it doesn't mean that you like can't go outside. So with proper precautions, it's not too much downtime. Um, Please confirm. Yeah, so active and deep FX lifting the neck. I would think of it as more of helping with texture, crepey skin on the neck. So if you have more like the loose turkey neck, that needs to be more either old therapy or surgical type of procedure. Pricing, I've gotten a few questions just on like pricing and if we're doing like different types of lasers in one session. So it'll be kind of like case by case, which is why, we'll do a consult or a pre-op and go over that pricing, but you will get to take the 15% off the whole treatment. So that's good. Um, this might be our last question, but do you need to stop using Retin-A before treatment? So yeah, we usually have you stop it like 2 weeks before. We really just don't want you being like all peely. Pre-op do's and don'ts. I will say it is helpful if any of you have heard of elastin nectar to pre-treat before your CO2 treatment. So it's been shown if you start 2 weeks or more before you do a CO2 that you have faster healing. So if you are looking to like have the best healing process that can exist, that can help. And so that's actually like a serum that we have in our office for purchase, and it's like a day and night thing, but it just helps your skin cells turn over faster. Therefore, you heal a little bit faster from the CO2. Um, we do prescribe like an antibiotic and antiviral to patients preventatively, pretty much for all the CO2 treatments. Any other do's and don'ts? Trying to think. Sometimes we'll have you stop some vitamins beforehand, like a week beforehand, just so that you have less bruising. If we are treating around the eyes, one thing to be aware of is we do put a special contact in your eye, this little contact lens. I will put it in. That's the safest, best way to treat around the eyes, and that allows us to get close, into this crepey skin area. But it's totally like painless for you, and I do it all the time, so it's not a big deal. Um, and if you are doing the full face and if you wear contacts, we ask you not to wear those. Um, how long the results tend to last. So CO2 laser or active and deep FX, it's a laser result that lasts, I would say, at least 5 years, if not more than that. So it's definitely like a little bit more downtime than some of the lighter lasers, but it lasts so long that, all those pictures I showed you of the kind of vertical lip lines, smoker lines, those patients are going to be great for a while, and they'll probably not need to do another treatment. So yeah, this was great questions. Thank you all for coming. I know there's a lot of different things you can be doing with your Tuesday evening, so thanks for tuning in. And again, yeah, if you're interested, make a consult with me or with Devin. whichever is more convenient. And she'll also be following up with you a little bit just in case you have any questions. But again, I appreciate you all coming. I hope you have a lovely evening. Bye.